Hello and welcome to Pregnancy Info. Today we are going to discuss all about water breaking. Your water breaking is a sign that labor is coming. The fluid you feel gushing or tickling from your vagina is amniotic fluid, the liquid that surrounds and protects a fetus. Call your healthcare provider immediately if you believe your water broke. What is water breaking? A fetus grows inside a bag of waters called the amniotic sac during pregnancy. The amniotic sac is inside your uterus. It is filled with a water-like fluid called amniotic fluid that protects the fetus. When the amniotic sac tears, amniotic fluid comes out of your vagina. This is your water breaking, and it's a sign that delivery is right around the corner. What does it mean when your water breaks? Your water breaking means contractions will start soon and that delivery is coming. How do you know if your water breaks? If your water may have broken if you experience a popping feeling followed by a gush or trickle of fluid from your vagina. Fluid is your underwear or down your leg in either small or large amount. Wetness that's odorless and clear or pale yellow. Uncontrollable leaking from the vagina that you can't hold in. Leaking fluid that's thin and watery instead of thicky and sticky. Leaking fluid flow followed by contractions that are stronger than before. If you are unsure if your water broke, it's helpful to put a clean pair of underwear or a sanitary pad. Don't put a tampon inside your vagina. Lie down and relax for 15 to 30 minutes. When you stand up, see if fluid comes out. If the fluid is your water breaking, it should come out when you stand. Possible causes. There are some possible causes that can cause water breaking. Number 1. Fetus brain signals. No one is entirely sure what happens in a person's body to cause the amniotic sac to break. Some experts think it's caused by signals in the fetus brain or some hormones that weaken the amniotic sac. Another cause is the contraction. There are no signs that your water is going to break. However, most people will be in labor and have contractions before their water breaks. So if you are in labor and experiencing contractions, your water can break at any moment. What does it feel like when your water breaks? It feels a little different for everyone. The fetus head acts as a cork to plug the cervix. Some people feel a popping sensation followed by a gush of fluid, while others feel nothing. Amniotic fluid can trickle into your underwear like a raindrop or rush down your legs like a waterfall. As contractions progress and as the fetus moves, more fluid can leak. It doesn't hurt when your water breaks, so you shouldn't feel any pain. Now, the question is that, can your water break early? Yes, your water can break before you are full term or 37 weeks pregnant. This is called premature or pre-labor rupture of the membrane or PROM. It happens in about 8% to 10% of pregnancies. You are at increased risk of PROM if you smoke, have vaginal bleeding in the second or third trimester, have inflammation or an infection, have had previous PROM, have a short cervix. There are several causes of treatment your healthcare provider may take if your water breaks early. If you are at least 34 weeks pregnant, delivery might be safest choice. If you are less than 34 weeks pregnant, your healthcare provider may delay delivery by using antibiotics to prevent infection, using steroids to mature the fetus lungs, using magnesium sulfate for the fetus brain. Care and treatment. How long after your water breaks do you have to deliver? The exact timing will vary depending on how far you are in pregnancy and if you have any health conditions. In most cases, your pregnancy care provider will want to deliver your baby within 24 to 48 hours if your baby is preterm. Your healthcare provider may be able to use medications to delay delivery. This usually requires careful monitoring in the hospital. How long after your water breaks do you go into labor? For most people, up to about 90%, labor starts before their water breaks. If you are having contractions, you are already in labor. These contractions usually intensify once your water has broken. If you have no labor symptoms, contractions will typically start within 24 hours of your water breaking. How do you tell if your water broke or you peed? It can be hard to tell the difference between leaking pee or amniotic fluid, especially if you are in the middle of contractions. These are a few factors that may help you tell the difference. Pee is usually dark yellow and has a distinct odor. Amniotic fluid is mostly clear or light yellow and odorless. You can't stop amniotic fluid if your water breaks. You won't be able to hold it like you can hold the pee. Amniotic fluid continues to leak where urine doesn't. In most cases, your bladder empties and doesn't fill up again and that quickly. There's usually more amniotic fluid than pee. At 36 weeks of pregnancy, you can have up to 4 cups of amniotic fluid. It goes down as your baby's due date gets. The human bladder can only hold 2 cups of pee. When do I call my doctor if my water breaks? You should contact your healthcare provider right away if you believe your water has broken, especially if accompanied by fever, foul-smelling odor, blood, or a change in the fetus movement. If you are not sure if your water broke, then can help you. Once you contact your provider, they may ask questions like how much fluid came out, what color was it, did it have a smell, did it have a texture, how long has it been since it happened, are you having contractions, did you test positive for group B strep, how many weeks are you? Remain calm and try not to panic. In most cases, your healthcare provider will want to deliver your baby within 48 hours of your water breaking. How much water comes out when your water breaks? It depends. Some people lose a little bit at a time, while others will experience several large gushes. Your amniotic sac holds up to 4 cups of amniotic fluid at 36 weeks. As your baby's due date approaches, the volume of amniotic fluid down. At 40th week of pregnancy, there are about 2.5 cups of amniotic fluid in the amniotic sac. Does your water break always? Yes, for vaginal delivery, your water must break. However, it doesn't need to break for cesarean delivery. In rare cases, your baby can be born while still inside the amniotic sac. Will a doctor break water? Your healthcare provider may break your water. This is an amniotomy. It involves inserting a thin tool through the vagina to break the amniotic sac. It performs when labor has stalled or to speed up labor. So, this is all about amniotic fluid, the time of delivery and labor, all in this video. So, share this information with the females who are pregnant and want to know about the water breaks. Thank you. Take care. Bye-bye.